9 months.
多謝主席。
Last question seeking an oral reply, Mr. Adrian HO. Thank you, President. Recently, the dismissal of an intern and a resident doctor in public hospitals by the Hospital Authority (HA) due to their serious improper acts has aroused public concerns. In this connection, will the government inform this council whether it knows 1. The number of individuals who completed their internship but were not awarded a certificate of experience (COE) or were not registered as medical practitioners in the past 5 years, and the reasons for this, the number of complaints or reports received by the HA involving breaches of professional conduct by intern or resident doctors. 2. Whether the HA has a regular mechanism to monitor access logs of its clinical management system and an internal alert mechanism for abnormal access. If not, whether the HA plans to enhance system security and confidentiality, such as exploring the introduction of fingerprint and facial recognition access control, or requiring doctors to provide continuous justification and obtain authorization from the attending doctor when conducting cross-hospital patient record queries so as to safeguard patient privacy effectively. And 3. Whether the HA or the Medical Council of Hong Kong (MCHK) plans to formulate guidelines that clearly define behaviors constituting professional misconduct for doctors to comply with and to liaise with the Faculty of Medicine of various universities to strengthen medical students' awareness of professional ethics through their curricula. Secretary for Health. Deputy President, the medical profession is a core element of the healthcare system. The Medical Registration Ordinance, or MRO for short, CAP 161, provides a legal framework for regulation of the registration of the medical practitioners in Hong Kong. The Medical Council of Hong Kong, or MCHK for short, is a statutory body established according to the MRO, responsible for various statutory functions related to the medical profession, including the registration of medical practitioners. According to the MRO, to be qualified for full registration as a medical practitioner in Hong Kong, a medical graduate from a local medical school must be engaged in full-time employment and training in the capacity of intern doctors in a public hospital, assessed and recognized by the MCHK for not less than 12 months, pass the assessment by the relevant medical school and DHA, and obtain a certificate of experience, or COE for short, awarded by the medical school. The HA demands the highest standards of professional conduct, behavior, and discipline from its medical practitioners. All public hospital doctors, including intern doctors, resident doctors, and specialist doctors at all levels, must possess medical competence and conduct themselves in a professional manner, placing patient well-being, privacy, safety, and care as their foremost priority at all times. In consultation with the DH and the HA, our consolidated reply to the question raised by Mr. Ho is as follows. 1. According to the MRO, a local medical school may award a COE to a medical graduate only if it is satisfied that the graduate has been engaged in medicine and surgery during the internship employment at public hospitals under the HA and that the service has been satisfactory. Obtaining the COE is a prerequisite for applying to the MCHK for full registration as a registered medical practitioner. Doctors who have completed full registration may serve as resident doctors in the HA to provide clinical and related services while undergoing specialist training. From 2021-22 to 2025-26, the HA recorded around 12 to 35 disciplinary cases due to poor performance or breaches of professional conduct involving intern doctors and resident doctors per year. Among such disciplinary cases, 3 intern doctors failed to complete the internship due to poor performance, misbehavior, or criminal conviction, thus unable to be registered as medical practitioners. On top of the cases above, 10 intern doctors were unable to complete internship and register as medical practitioners because of resignation on personal grounds such as health issues or because of failure to complete the internship. The above cases make up a very low percentage of the total intern doctors and resident doctor workforce of around 4,200. Detailed figures are set out in the annex. In this period of 5 years, all doctors who completed the internship were awarded the COE and were registered as medical To To safeguard the security of patient data, the HA enforces strict gatekeeping on the usage of the Clinical Management System, or CMS for short, across 5 major dimensions. On the application for the CMS account, each staff member must first complete a training course on privacy. Each application for account creation must be reviewed and approved by department head. 2. On access to system functions, functional permissions for users of different grades vary according to operational needs. The system retains access logs to ensure traceability and accountability. 3. On access and control on patient records, when a user enters a restricted access zone, the system will prompt and mandate the input of a reason for the access and remind the user at the same time that such access is subject to audits. 4. On regular auditing and monitoring, the HA regularly reviews system accounts, user authorizations, and access logs, and receives alerts on abnormal cases through the Advanced Incident Reporting System and the Personnel Notification Mechanism. And 5. On cybersecurity, the HA will continuously enhance system security to ensure data confidentiality and security. 3. Courses on professional conduct and medical ethics are compulsory for local medical students in local universities. They ensure students are acquainted with professional values and standards of good conduct prior to graduation. The MCHK will continue to maintain communication with universities, medical schools to enhance medical students' awareness of professional conduct through strengthening relevant content during the regular accreditation of medical programs. The MCHK formulated the Code of Professional Conduct, or the Code for short, in 1994 to regulate aspects such as the professional responsibility over patients and provides specific guidelines for all doctors on matters including keeping medical records, protecting patients' privacy, and dissemination of information to the public, and is subject to update from time to time. Just now I held in my hand the latest updated version, which was released in 2022. Intern doctors must abide by the code, non-compliance of which will result in disciplinary sanctions as a result. Even if they have been granted the COE, the Medical Council of Hong Kong may still order not to register them as medical practitioners in accordance with the MRO. In spite of the nature of the code as a guideline, the government has submitted an amendment bill to the Legislative Council which recommends empowering the MCHK to formulate and promulgate codes of conduct, granting the codes of conduct statutory status. The relevant amendment will further strengthen the authority and binding effect of the code in favor of regulating the practice of all doctors, including intern doctors, and enhancing professional conduct. On the other hand, to ensure staff compliance with ethical standards, all staff of the HA, including intern doctors, must comply with the HA Code of Conduct in addition to the code as mentioned above. That is the green booklet which is in my hand right now. The HA Code of Conduct emphasizes that staff have a duty to protect the HA's and the patient's information, records, and property against improper or negligent disclosure, misuse, or unauthorized usage. The HA has set up the Committee on Teaching Hospitals to communicate regularly with university medical schools on matters relating to the training of intern doctors and medical students. We have also set up the Central Internship Committee. Deputy President will continue to stringently enforce the regulatory mechanism for medical practitioners, foster excellence in medical training to assure the professional integrity of doctors, and safeguard the rights and interests of patients. Mr. Adrian HO, thank you. Data show that in the past few years, a number of intern doctors and resident doctors were dismissed. The disciplinary hearings of the Medical Council of Hong Kong have been delayed for a number of years. I would like to ask, can these doctors practice in private hospitals or private clinics while earning a large paycheck? Thank you. Secretary, for intern doctors, when they fail to complete their internships, in theory, they cannot be registered as a medical practitioner. So a dismissed intern doctor will not be able to practice in the private market or the private sector. Regarding HA staff members who have been registered as medical practitioners upon full registration, if they are dismissed on the grounds of professional conduct, then the case will be referred to the Medical Council of Hong Kong. In other words, that person involved will be subject to the disciplinary hearing at the Medical Council of Hong Kong. Their practice qualifications or eligibility will be handled. Thank you. Mr. Ken Lee. Medical practitioners need to undergo a strict course on medical ethics at the medical school. Before full registration, medical practitioners will have to take an oath. However, it is apparent that judging from this incident, relying on the oath isn't sufficient. Is it possible to incorporate regular tests? Can we draw reference from overseas jurisdictions? That is, can we introduce scenario-based assessments to assess medical practitioners' capability when it comes to medical ethics and decision-making whenever there is any conflict of interest? We need to nip these incidents in the bud. Thank you, Secretary. Indeed, before doctors receive medical training, they have a ceremony in which they need to wear their white gown and then take an oath. They take either one of the two oaths available. That is, they need to devote their medical career and they need to prioritize the well-being of patients above all else. They undergo a lot of training throughout their career, but we understand a lot of things are subject to change in our lives. Regarding scenario-based assessments, from my perspective, simulated assessments cannot be compared to real clinical experience. In this regard, younger doctors learn from more experienced doctors. This is exactly how their compassion and care for patients are cultivated. This is a clinical approach. From my perspective, clinical experience is much more important and concrete than simulated assessments. Thank you, Professor Chen Wen-Kwong. Thank you, Deputy President. I'm glad to see that the administration adopts a series of measures to protect the information security of patients. However, a lot of healthcare professionals share their daily lives on online media platforms, targeting these incidents in which privacy of patients is disclosed online. Will medical schools and the HA enhanced guidelines in relation to medical ethics education? We need to remind medical officers that in real life or in the virtual world online, they need to prioritize the well-being and the privacy of patients above all else. They cannot disclose any privacy of patients online. Secretary, thank you. Especially the younger generations, there's been a widespread use of social media at present. From medical schools to the hospital authority, regarding the use of social media, there are plenty of guidelines on the privacy of patients for doctors to comply with. In 2022, a guideline on the use of social media was published. This guideline covers doctors as well as dentists. Guiding principles and recommendations are set out in this guideline. Doctors as well as dentists need to comply with this guideline. Thank you. Ms. Rebecca Chen. In the main reply, intern doctors and resident doctors, owing to their serious, severe misconduct, are subject to verbal warnings or even dismissal. Intern doctors and resident doctors have less experience. They should be monitored by their higher-ups. Their performance needs to be assessed. I'd like to ask about what about the management? What about the internship coordinator, department head, ward manager? Should they be subject to written warnings or verbal warnings as well? They are responsible for monitoring the younger doctors. Thank you, Secretary. Doctors are trained at universities. Upon graduation, the HA is responsible for clinical training. Each rotation lasts 3 months. More experienced doctors are tasked with training these younger doctors. Within this period of 3 months, if their performance falls short of expectations, this will be detailed in their appraisals. In some situations, their contract may be terminated prematurely, or these underperforming doctors may be dismissed. I believe these more experienced doctors have already fulfilled their responsibility and they should not be penalized on these grounds. Thank you. Mr. Hong Come In. Thank you, Deputy President. I acknowledge the professionalism of the healthcare profession in Hong Kong. I acknowledge their conduct as well. However, recently, some incidents in society have aroused public concerns, and we do need to address this situation squarely. In the future, will the medical schools in Hong Kong provide courses on medical ethics for doctors? Medical students need to make sure that they will comply with all the guidelines in relation to the data privacy of patients. Secretary. Medical school training emphasizes ethics and professional conduct of doctors. These are exactly what medical students need to learn. These are mandatory courses for them. If we glance at the figures, it seems that there have been more issues with intern doctors, such as professional misconduct or underperforming internship doctors. However, in the past decade, we have increased the number of medical students by far. Now, every year, there are as many as 590 medical students. So, if 3 doctors out of a total of 590 are dismissed owing to underperforming standards, we still have 2,500 medical students graduating in the past 5 years. The quality of the healthcare profession and education is still very high. Thank you. Dr. Johnny Ng. Some medical disputes have been resolved by way of monetary compensation or mediation. I'd like to know how the government will deal with this issue, as incidents involving public misconduct cannot be resolved just on the basis of monetary compensations. Secretary, we have always emphasized that for issues involving professional misconduct, these should not be handled by way of money or monetary compensations. If an issue has to do with professional conduct of doctors, this will have a bearing on patients. These cases will be referred to the HA or Medical Council of Hong Kong. They conduct independent investigation or disciplinary hearings with a view to assessing each case. They will decide whether each case has to do with professional misconduct or the capability of the doctor. This is exactly how they decide whether a doctor can still practice. Thank you. Reverend Peter Kuhn. I'd like to ask about the recent accidents which are baffling. Had the persons involved not uploaded the relevant pictures online, how could these incidents be brought to light? Under the existing mechanism, how can we monitor the situation? Thank you. I'd like to confirm with you, Reverend Peter Cohen, for the baffling incidents you just now mentioned. I believe we are referring to the incidents involving intern doctors and resident doctors. I believe we are on the same page. Regarding these acts, we agree that this is far from being ideal. The persons involved should be condemned. Disciplinary sanctions have been exercised. The relevant intern doctors and resident doctors have been dismissed. Hospitals operate around the clock. A lot of colleagues are working 24/7. If some incidents had not been brought to light, probably no one would have come to find that these accidents have actually happened. We, however, encourage staff members to report such incidents. This is what we want to see. We want to enhance the level of professionalism in Hong Kong. Thank you. Mr. Adrian HO, thank you, Deputy President. The Secretary emphasizes professional conduct is a compulsory course for local medical students. If this is the case, why for grade 8 students keep breaching professional conduct? Do they only aim at good results while undermining professional conduct? Secretary, well, I believe examination scores or results do not have a direct correlation to professional conduct. DSE results are going to be announced, followed by the results of IB, which have been released. Medical studies is a well sought-after subject. We attach a lot of importance to doctors' conduct in addition to examination results.
Government Bill's first reading.